Pop Health Podcast is a public service of 24-hour home care. Hello, everyone, and welcome to another episode of Pop Health Podcast. This is Gavin Ward, host of Pop Health Podcast. And in today's episode, I had a very special guest who I've known since he was a wee lad, and that is Dr. Kevan Akrami, who's serving on the front line in the ICU and is an infectious disease expert, serving on behalf of the University of California, San Diego. And he spends about half his time up here in San Diego, and then I guess I could say the majority of his time down in Brazil. Dr. Akrami joined the show right after a shift on the front line in the COVID unit at UCSD Medical Center. We get to know a little bit about Dr. Akrami, but mostly we talk about COVID and his frontline experience, including how one of the painful parts of his role is seeing folks at the end of life without family being close by. But on the brighter side, he talks about the strength of the medical teams and the staff that are powering through and coming together during this time of a common enemy with COVID. Dr. Akrami shares some more pros and cons of his experience with COVID, his life and experience and passion about infectious disease, where he's learned about it in North America, where he lived in Africa, and also where he's lived in South America. We hope you enjoyed today's episode, and feel free to check out other episodes of Pop Health Podcast by visiting us on YouTube, pophealthpodcast.com, Apple Music, Spotify, or Stitcher as well. Thanks, everybody. Enjoy the show. Dr. Akrami, thanks so much for joining us, especially after a 12-hour shift.
Thanks for having me. Glad to be here.
No problem. So we're recording bright and early. Actually, the sun's just coming up. You can see it behind me. So Dr. Akrami just came off a 12-hour shift down at UCSD in the COVID unit, and he's been kind enough to join us. Dr. Akrami, before we get into discussing healthcare, I want to get to know a little bit about you. So could you share something about yourself that might surprise the audience, something outside of the workplace?
Sure. Yeah. So I think being in San Diego and in Southern California in general, surfing is my outlet. That's where I go to wash my soul in salt water in between shifts and otherwise. And living between Brazil and San Diego, kind of have a wealth of waves to enjoy in both locations.
Awesome. And what is your favorite surf spot?
So Swami's in San Diego is one of kind of world-class waves in California. I think it's probably one of the best waves that's around to surf. So that's got to be up there.
Nice. I know we were talking previously, Dr. Akrami mentioned the waves there about 4 to 8 feet. And also there might be some a celebrity every once in a while popping up there, right?
That's right. Yeah. So that used to be this kind of stomping grounds of a growing up Rob Machado, who was kind of a contemporary of Kelly Slater back in the day. And he's been out there a few times when I've gone surfing on one of his custom-made wooden board, single plank kind of finless things that he's somehow able to surf. So yeah, it's a great spot. Really good vibe of folks there, and not really too much of the local vibe that you can sometimes get in surf spots, I think, around Southern California.
Yeah, no, that's awesome. And I know with you living in San Diego and Brazil, you have plenty of opportunity to find some good waves and different hemispheres, which is pretty cool. So for those of you in the audience, I've actually known Dr. Akrami when he was just a little brother of one of my good friends. And of course, all little brothers are nerdy little brothers. So it's pretty cool to see my friend's, quote unquote, nerdy little brother now really being on the front lines of COVID and really leading the charge and actually, internationally. So Dr. Akrami, can you share with us briefly, of course, I know where you grew up, but maybe share with the audience where you grew up and how eventually you decided to go into medicine.
Sure. So yeah, I grew up in Arcadia. It's a kind of suburb of Los Angeles. And I think ultimately during high school, I kind of developed a curiosity about how the body works and how it functions and dysfunctions, and really trying to understand the physiology of that. And that was really kind of the initial curiosity that made me go on to undergrad and study physiology and neuroscience at UCSD. And was able to channel some of that interest in some volunteer work that I did through the 4 years I was in San Diego. We established a free healthcare clinic for a population in Ensenada, and recruited physicians to come down, and just kind of seeing the work that they were doing and the difference that we were making in the community in that way really motivated me to try to pursue a career in medicine at that time.
That is awesome. And I know we were also previously talking before the recording about some good taco spots. What was the name of the taco spot again?
Yeah, so there's Jose's Taco Stand that was right 2 blocks away from the clinic. So it's kind of on this dirt road off a beaten path that he'd be able to whip up some delicious tacos for a gaggle of 20 undergrads and some physicians at that time. So yeah, it's still there actually. Yeah.
Oh, nice. So you've been down there in the recent past?
Yeah. So I actually, when I came back to UCSD, I went down as one of the volunteer physicians. And so it ended up being this really cool kind of full circle experience 15 years after graduating, to then go down and see the undergraduates kind of continuing the work that we'd started all the way back in 2001.
That is awesome. Like, some great memories, obviously, and it's great that you're still serving, Dr. Akrami. So UCSD was where your undergrad is, and it's cool. It's neat to see you back there, your old stomping grounds. But after your undergrad, you went off to do your med school. Tell us about that.
Yeah, so I ended up going to Albert Einstein College of Medicine in the Bronx. And part of the reason that I was interested in that program specifically at the time, there was a really robust social medicine program and dedication to international work and opportunities for medical students to kind of get involved both within the city's own system. That's, New York City obviously is this kind of melting pot of the United States, but also to be able to go to other countries. And so in between my first and second year, I was able to do a medical Spanish program through the college. And then during my subsequent years, I was actually doing a medical Spanish kind of track within the Bronx. And so got to learn about the Puerto Rican, Colombian, Cuban accents, Peruvian, and kind of the various ways in which folks kind of refer to different ailments, and ultimately ended up going to Uganda for 3 months during my last year of medical school as one of the kind of like interns on the medicine wards there in a city called Kasoro, which is kind of at the interface between Uganda, Rwanda, and the Congo. And so when we were there, they had about a 10,000 person refugee camp that was for folks escaping from the Congo due to violence and other things. So really cemented my interest in global health at that time.
Yeah, so you've lived in Africa, North America, South America, anywhere else?
I think those are the main places where I'd consider that I've lived. Yeah.
Nice. Awesome. Well, it's great to learn more about your background, Dr. Akrami. So you're back at UCSD where you did your undergrad. Prior to the outbreak, you were also back at UCSD. And what type of work were you doing prior to the outbreak?
Yeah, so my role here, basically, I work as both an infectious disease specialist and an intensive care physician. And so most of the patients that we were kind of encountering in either of those capacities, UCSD is a partner referral center for advanced cancer and robotic surgeries, and kind of serves as a encatchment area for a lot of San Diego and heading east, even out as far as some parts of Arizona. And so we were having a lot of patients with complications related to bone marrow transplants and advanced cancers, and a lot of side effects from different medications in the context of clinical trials. And so that was basically the kind of day-to-day that we were dealing with, which was very complex. And, folks who are ultimately coming here because there were no other options for curing their cancer in certain circumstances. And so emotionally challenging, but also, very gratifying when things worked out with our patients.
That's great. And so with UCSD, you're actually not, or you were not necessarily working for UCSD all the time. Tell us about this time in San Diego versus time in Brazil.
Sure. Yeah. So that was the clinical time. And then the rest of my time was really dedicated to developing a research and educational collaboration between UCSD and colleagues in Brazil. And so I ended up going down there during my third year of fellowship through the infectious disease program, and ultimately was able to establish a couple of research projects that we had pilot funding through UCSD to study some mosquito-borne illnesses like Zika, which we haven't heard about for 5 years here at least, and chikungunya and some other viruses that have been kind of circulating. And so my main focus was virology, and then specifically about kind of novel ways of diagnosing emerging infections. So was doing that for the past 3 years before coronavirus emerged.
So did you meet, I know your wife is from Brazil, or at least speaks Portuguese. Did you meet her?
So she and I had met while I was working in Mozambique through a medical education initiative that we had through the university and the medical school in Maputo, Mozambique. And so when everybody asks us where we've met, that ends up being nobody's answer, because an American and Brazilian meeting in Mozambique is like not something that anyone imagines.
Yeah, no, that's funny. My wife's mom is 100% Chinese, but she lived in Mozambique. And her husband is 100% Cuban, and he lived in Mozambique. I'm sorry. Yeah. So long story short, when, it's your story is definitely unique, but I guess Mozambique brings together people from different cultures, surprisingly.
Yes.
Nice. So how has COVID, before we get into what you're doing during the pandemic, you mentioned what you're doing prior to COVID. How has COVID changed your life and your schedule?
So while in Brazil, my kind of day-to-day schedule would be going to the hospital to round in the ICU with the medical students and residents a couple times a week. And then the rest of the time was essentially spent working with the medical students and researchers at the Research Institute to basically work through both the kind of basic science aspect to the research, so designing new assays and testing new assays for diagnosing and distinguishing Zika from dengue, and then doing some teaching on the side as well with the medical students at the Federal University. And so that was basically kind of the structure that I had up until March of this year. So
March hits, and then what happens?
So March, I basically, with some of the colleagues at the Infectious Disease Hospital in Brazil and in Salvador specifically, where I live, they were starting to receive patients with coronavirus infection, and actually we're in the process of converting the medicine wards into an ICU. And so because I'd been working with them on research projects, offered to help. I was able to get my medical license in Brazil, and so offered to help set up the intensive care unit for the medicine wards, and so kind of transition. And at that point, basically stopped all my research, all the teaching, and was 100% kind of clinically involved in taking care of patients and really trying to train the staff, train the nursing, respiratory therapist, and the other physicians who didn't have intensive care expertise in terms of the things that we would need to do in order to save these people's lives. And so basically the day-to-day workload ended up being much different. I think, I ended up being on service with 4 days off a month, and continued that through June. And so we basically went from a closed unit with closed doors where you can't monitor, rationing out protective equipment, personal protective equipment, and developing different protocols. I was actually able to also incorporate a little bit of research into that, in that our hospital was one of the sites for the WHO's Solidarity trial, which was kind of this rapidly deployed study looking at which medications may make a difference in those patients hospitalized with COVID infection. So even in the midst of kind of COVID, I was still able to work with the researchers and see ways in which we can enroll patients, try to do the study in the best way possible, recognizing that kind of clinical care came first, but we would try to do the best we could in terms of carrying out the study. And ultimately, the results from that study just got published, I think, a month ago, looking at kind of the benefits of the different treatments available.
Where can people find that study?
Yeah, so it was published, probably PubMed, if you just type in Solidarity Study, WHO. It'll take you both to the WHO's site, and then that also has a link to the publication, and then the study design, and any other publications associated with the study.
Okay, great. So that was through June. Now you're in San Diego, where we're recording today. How did you make your way back up to San Diego and serve on the front line there?
So initially, my schedule basically is coming back twice a year to kind of fulfill my clinical responsibilities here at UCSD. And so when I came back, basically was set up to do my month of July in the ICU, and that just happened to coincide with one of the peaks of cases in San Diego. And so in addition to that, I'd been doing telemedicine through the university with one of our hospitals that's on the border. And so kind of had a unique experience in that I had this very intense resource limited experience. To a certain extent, it was mostly the capacity of the folks on the ground. So in Brazil, the nurses that we transitioned from medicine wards to ICU nurses within a week was the most challenging. We never ran out of ventilators. We never ran out of pumps. There were medication shortages, but we made adjustments. And so I didn't see that same level at El Centro, and certainly didn't see that at UCSD. But I think, it's interesting looking back on that time. I think now we're approaching, so I've continued to do telemedicine with this hospital through UCSD, and I've seen that they've had to change their nurse to patient ratios. And if things continue the way they have, I think very soon we're going to have to start relying on non-intensive care trained nurses, physicians, and respiratory therapists to provide the care for these patients, because we are, I think, entering a phase where machines may not be the main shortage that we're concerned about, but it's actually going to be the bedside nursing and critical care expertise that's going to be lacking.
Yeah, on your shift last night or through this morning, I'm assuming you guys are full or close to full. Can you tell us about your current census in your ICU where you just worked?
Yeah, so we have one code bed available for our inpatients, and there are multiple plans in terms of surge capacity. And so once we kind of hit a certain number, then we're going to be opening up different units, and the nurses in the kind of step down units are going to be paired with the ICU nurses to try to provide that oversight if it comes to that point where we no longer have ICU trained nurses. So here we have folks who are on ECMO, and so that's just basically lung bypass machine when somebody has very severe disease that you're not able to treat through just a ventilator alone. And so it's very labor intensive, requires expertise that our nurses have. But again, I think right now we are not at kind of that critical transition point yet. And there's kind of plans in place to expand if necessary. But our kind of sister hospitals in the neighborhood closer to the border have lines of ambulances lined up waiting for ICU beds. We accept patients from Riverside all the way down to kind of East County. So very large and catchment area of folks that we're bringing over to the university.
Yeah, I saw you're talking about San Diego, your sister hospitals. Obviously, you represent UCSD. If you wouldn't mind, I actually just read an article from the CEO of Scripps, which I'm sure you're familiar. His name is Chris Van Gorder. He's actually been on the show before. And one of the things he touches on is COVID fatigue and how he understands that the general public is tired of COVID fatigue. And he's tired, that the general public is tired of COVID. And so obviously your staff are tired. Why should, or someone who says, you know what, I don't have to wear a mask, it's my body, let me do what I want. How would you respond to somebody who says that?
Yeah, it's interesting. I think early on there was a lot of kind of discussion and debate about whether, wearing a mask increase your risk of having more severe disease? Is it really protecting you? And I think by and large that debate was over by April. And so I think anyone who's saying that since then, I think is, I think there's always going to be a balance of kind of an individual's rights against the community's well-being. And so the fact that someone is willing to take on the responsibility and risk of themselves getting infected is very different in the case of a transmissible disease. And so the fact that this is airborne, if you're in an environment where there's poor circulation, no one is wearing masks, and you have one person infected, this is a highly contagious pathogen. And so what I would say is, there was a great case series actually out of Maine that was published by the CDC back in May, I believe. And they basically had a wedding where 55 people were in attendance. One person was infected. And from that kind of wedding, I think over 170 people ultimately were infected. 7 of those went to the hospital and another 7 died. And those 14 people didn't attend the wedding. Yep. And so when people make a decision to go to an enclosed environment, not use masks, and have a poorly ventilated area, there's going to be a huge risk of transmitting that to people who have nothing to do with you taking on that responsibility. So that's kind of the community side that I could speak to. But then me as a critical care physician, if you get sick and you need a tube to help you breathe, I would be putting that tube in and exposing myself to that risk. And so it's very different from something like HIV, for instance. If somebody says, I'm going to get this infection with my habits, but ultimately, and you may pass that on to several people. So it's, HIV is the biggest pandemic that we've had. in our kind of modern history. But the way in which coronavirus is transmitted is exponentially more contagious, and carries, again, I think the question is, when people say they can't breathe with a mask on to go to a supermarket, I will say I've had it on for 24 hours and we are not, suffocating as a result. And so I would just encourage people, everybody has their right to kind of decide what's best for them, but I think need to recognize that this is a very different experience than anything else that we think of kind of individual liberties. Yep. I think stop in this situation where you're putting someone else's health at risk that has nothing to do with the risk you're willing to assume. I think the kind of drunk driving example is a good picture of kind of like, well, I'm willing to take on the risk of drinking and driving, but ultimately you could end up killing somebody else. And so I think that's, we have laws in place for that. And so I think while we have this pandemic, mandatory masks within enclosed places is just something that you do out of caring for those people around you, basically.
Okay, so Dr. Akrami, as we're recording this at the end of the year, the vaccine is out. We have the Moderna vaccine, the Pfizer vaccine, and one of the terms that's thrown out there is this whole 95% efficacy term. And that term does not necessarily mean 19 out of 20 shots works. Can you explain what 95% efficacy means in layman's terms?
Sure. So basically, the way that these numbers are arrived at is you have one group of people who get the vaccine and another group that gets placebo. And because we've done kind of internationally such a poor job of controlling this virus, there are lots of cases of infection. And so one of the reasons that this was able to be done so quickly is because it's different from other kind of vaccine trials that take a much longer time to see incident case rates. And so if you basically, you have one group of people who got the vaccine who were not infected, and then you had another group that got placebo who was infected. And based on those numbers, that 95% refers to the fact that by taking the full course of the vaccine, so the initial and booster doses, your chance of infection is reduced by, you are 95% less likely to be infected compared to somebody who didn't receive the vaccine, so the placebo group in the clinical trial.
And that was for pretty much both the Moderna and Pfizer.
Exactly.
I know AstraZeneca is trying to come out with something by early 2021, so we'll see about that. Now, one thing as well that's different about the vaccine is the whole mRNA way of developing it. Can you share a little bit about mRNA and how that's different?
Yeah, so traditionally we have either live attenuated or kind of like weaker live viruses that would be injected. So smallpox or measles, mumps, and rubella are kind of the prototypes for that. And then we have others that basically we stick a protein on a dead virus backbone, basically, and inject that and try to trigger an immune response. This kind of shortcuts that process in that instead of injecting the protein, we're injecting kind of the script to make that protein. And so the same result ends up in that parts of the mRNA gets into the cell, your cells start to produce the protein, express that on their cell surfaces, and activate the immune response. And so really there's nothing kind of too novel other than that it's a very quick way to make a virus that doesn't depend on basically egg-based products that has a very long latency time for the traditional vaccines. And so really you're basically taking a shortcut from having the virus be taken up by the cell, protein broken down and then expressed. You're actually just saying, my immune cells, you're going to take up the mRNA because it's foreign in the body, mRNA floating around in the bloodstream automatically is taken up by our immune cells. And eventually that mRNA is going to produce a protein within the cell that it'll express on its surface to announce we have something in the body that's not us. We need to react against it. And so that's the way that we generate an effective immune response.
So Dr. Akrami, as we get to the close of today's show, I want to ask you, what would you say is the hardest part or the most challenging part of serving on the front line during the pandemic?
I think it's twofold at this point. The initial stress of having patients come in that are unable to be surrounded by their family. In Brazil, that is a huge part of, in the hospital, you always have some family member that's with you basically 24/7. And I think that was something that was very hard to kind of witness. And then also when we had patients who didn't make it, they essentially, were surrounded by strangers who were taking care of them in the last moments of their lives. And so I think that created a lot of emotional turmoil for both the staff, but also the family members who, their last moments with their loved ones would be through an iPhone or an iPad. That I think has been something that's been, vocalized a lot. And I think it's very different than how we are able to generally provide end-of-life care for patients. That, the way that we envision a good death, I think is something where even though we're able to provide, comfort from the staff, the fact that the family is unable to be in the room with their loved ones for however long they have has really been devastating. And we've also had cases where entire families have been essentially devastated, where I can think of numerous examples, but one in particular where a wife lost her husband, her brother, sister, daughter, and son, and she was the sole survivor of coronavirus infection. And so I think that's been just seeing those, the lack of what we're accustomed to at the end of life, to be surrounded by family and feel that proximity. And then also, I think within medicine, we tend to have to have a certain amount of emotional distance just to maintain our own sense of well-being. And I think that's been eroded because ultimately we are then called on to be in the room with the patients in those last moments and provide some semblance of familiarity and comfort to them that their family would have otherwise been providing.
Yeah, that's, I appreciate your transparency and vulnerability there, Dr. Akrami. And, hopefully that you mentioned that the distance, the emotional distance that you're, professionally supposed to keep has been eroded, and that's reasonable. But I'm hopeful that your staff can provide some comfort. And maybe let's jump into what are some of the positives, or like what's something, 5 years, 10 years, 20 years from now, you look back and be like, hey man, this was one of the benefits of serving during this time.
Yeah, I think, it's interesting, the resiliency of the human spirit, so to speak. I know that might be a little kind of commonplace, but I think both in terms of what I've seen, our staff in San Diego, in Brazil, have gone above and beyond what they are, what they thought they were capable of doing. And I think, that has been something that has been really awe-inspiring to see people really sacrifice and essentially responded to the call to arms against this virus, and were willing to not only kind of push themselves physically, emotionally, and put themselves in harm's way, but have done it in a way that has still aimed to maintain compassion, even in the midst of a lot of tragedy and sadness. And so I think the resiliency of the medical teams in these very disparate environments has kind of pointed to this common goal, I think, in healthcare specifically, of trying to provide what you can, and then pushing your limits to then go above and beyond what you thought you were capable of. So I think, that's probably, looking back, will be something that I will definitely take with me.
That's a great story and an example of the positives. A lot of times, or for me, I see this as kind of a war or a battle, and we have a common enemy, right? The common enemy is COVID, and we see times in history where a common enemy can bring people together to do things that were never foreseen before. So I think that's a great example that you shared, and that's what it reminds me of with the war. Let's end on a good note here, and which we are. What's one of the cool things of living in Brazil? What do you enjoy down there?
Yeah, so I mentioned surfing. Obviously, it's kind of my go-to for restoring my sense of well-being. But specifically, where we live is in Salvador, in the state of Bahia, and the food is amazing. There's a Portuguese African influence, so it's the largest Brazilian city of African descent. So the population reminds me a lot of Mozambique, and so the warmth of kind of the community there, and just the joyfulness in life. And I think it's interesting. Brazil, I think, is the capital in the world of memes to kind of make light of very dark situations, and use humor to really overcome a lot of adversity. And so that it's just been really great living in an area that is able to kind of embrace adversity in a way that's lighthearted. There's kind of within our city, that's where capoeira originated. So that's kind of the Brazilian martial arts. And so there's, if you watch that style of dance and martial arts, it's very playful. And I think that playfulness is something that I hadn't anticipated and have really enjoyed within our state in particular, but overall, and anywhere I've traveled in Brazil, there's this sense of joyfulness and playfulness. And I think you and I played soccer forever, and so the samba soccer is kind of a great example where there's just this little bit of showmanship and playfulness that I think it encompasses a lot of the lifestyle in Brazil that's just incredible.
Awesome. Well, I have to say, I haven't interacted with you much in our adult years, but when I have, I'll call you Kevan now to end the show. You have this joy about you, and I hope you're able to bring it to San Diego, and I think you are. I haven't been on the front lines with you, but I think that's a great testimony about the Brazilian culture and the life that you're living. So again, Dr. Kevan Akrami has been our guest. Kevan, as I'll call him, an infectious disease expert serving on the front lines of COVID-19, just coming off a shift. And I think you're going to sleep, catch some Z's, and going right back at it tonight, right?
Yes.
Well, yes. Very grateful for your time, Dr. Akrami, and appreciate the show. Folks, really quickly, getting folks on like Dr. Kevan Akrami is not always an easy task. Luckily, he's one of my friend's little brothers, so maybe this was a little bit of a connection there. But one of the reasons we're able to get folks like Dr. Akrami on the show is by you leaving a review. So I'd like to kindly ask, if you enjoy the show, please kindly leave a review for us on Apple Music or YouTube. That would mean a lot to me. And again, take care, Happy New Year, and here's to a great 2021. Thanks again, Dr. Akrami.
Absolutely, thanks.
Thanks everyone for tuning in to another episode of Pop Health Podcast. We hope you've enjoyed today's episode, and if you have and want to check out other episodes, visit us at pophealthpodcast.com, iTunes or Apple Music, Spotify, Stitcher, and now YouTube as well. Take care.